Good afternoon. Welcome to the daily briefing here in St. Clair County. Joined with Chairman Mark Kern and Sam Bierman. And Sam from the Health Department. A little good news today.
Yes, and I haven't been as excited to bring these numbers in a while as I am today. So for today, we are at 4,642 St. Clair County residents that have been tested, with 850 positive test results, which is an increase of 25 from yesterday. And that does include males and females under the age of 10 up to their 90s. We are currently at 3,771 negative test results, with 21 results still pending. And today we are reporting no new deaths, and the last time we were able to do that was back on May 8th. So really good day for that. And as far as patients that have completed the IDPH 14-day required quarantine, we are at 433. For state totals, 561,649 have been tested, with 92,457 positive test results, which is an increase of 2,088 from yesterday. And we are at 4,129 deaths for the state, which is an increase of 74 from yesterday. And as always, our thoughts and prayers go out to all of the families who have been affected by COVID-19. For hospitalization numbers, and these are for hospitals that are in St. Clair County, we have 47 patients that are currently admitted due to COVID-related reasons, and 5 of them are on ventilators. For congregate living facilities that are currently in outbreak status, and that is 2 or more staff or residents that are either COVID positive or who have COVID-like symptoms, Brea of Belleville has 23 cases and 2 deaths. Brea of Cahokia has 8 cases and no deaths. Caritas Family Solutions in Belleville has 7 cases and no deaths. Colonnade Senior Living in O'Fallon has 3 cases and no deaths. Four Fountains in Belleville has 103 cases and 17 deaths. Help at Home in O'Fallon has 5 cases and no deaths. Knollwood Retirement Center in Caseyville has 6 cases and no deaths. Lebanon Care Center in Lebanon has 51 cases and 9 deaths. Memorial Care Center in Belleville has 43 cases and 5 deaths. St. Paul's Home in Belleville has 10 cases and 3 deaths. Swansea Rehab and Care Center in Swansea has 4 cases and no deaths. And TDL Incorporated in Belleville has 4 cases and no deaths. And before I turn it over to Chairman Kern, I would like to bring up something. I know we have talked about masks and the need to wear them. And as we get closer to the dates where things are going to start opening up, we want everyone to realize that now more than ever is important to continue to wear your masks. IDPH and CDC just put out guidance last night that still talks about when we should be wearing our masks, which is shopping at any essential business such as a grocery store, farmer's market, pharmacy, any store of that nature, picking up food from either a drive-through window or a curbside pickup, or even when you're doing carry-out. While visiting your healthcare provider, especially while you're traveling on public transportation, as well as interacting with any customers, clients, and coworkers, both essential and in non-essential positions. So, the best way to keep yourself safe, wear your masks, continue to stay 6 feet apart, and continue to wash your hands. And if you don't have access to soap and water, hand sanitizer above 60% alcohol is your best bet.
And it's really the best bet for us to keep other people safe.
Exactly.
As far as wearing the masks. And Sam, although there was good news today, the one disturbing news statistic, we have our first child that's coming with these symptoms that we heard about from New York.
We do.
Can you describe it? So this 10-month-old came down with COVID, and then.
So what the information we received in the report was that the child had the antibodies for COVID-19, which means that he or she had COVID-19 in the past. And now they are experiencing systemic issues, so whole body-wide issues. And, obviously that's scary for anyone at any age. But when you're that young, you can't be explained as to what's happening. You don't understand why you're, being stuck with needles and, why you why you can't be with mom or dad, and it's a very scary thing. But as we talked about yesterday, this disease is not just for the elderly, not just for the immunocompromised. And as we were talking earlier, this little one, wasn't out, doing the things that we are telling everyone to do to stay, socially distanced from each other. This little one had no choice in what diagnosis they received. So that's why it's always important not only to think of yourself when you're out in the public, but to think of others around you.
Thank you, Sam.
Well, Sam, and I think also on the mask, I'm glad that came out late last night because there was some questions on the page about somebody had posted that Dr. Fauci had said that you didn't have to wear a mask anymore, and that's by far not true. So I'm glad that came in last night, and you're covering that today. So.
Yeah, and and like we said, even when we are starting to open things up, we're still going to need to keep these building blocks that we've started in place, and continuing good hand hygiene, socially distancing from each other, and wearing our masks.
Okay, very good. Thank you.
Great. Thanks, Sam. So we'll move into the zip code reports. 62201 remains at 13. 62203, we now have 27 COVID positive people in that zip code. That's an increase of 1. 62204, we have 33. 62205, we have 38. That's an increase of 1. 62205, that was 62205. 62206, we now have 76. That's an increase of 2. 62207, we now have 53. That's an increase of 1. 62208, we have 47. That's an increase of 1. In 62220, we now have 91. That's an increase of 4. 62221, we have 74. That's an increase of 1. 62223, we have 43. That's an increase of 1. 62226, we have 105. That's an increase of 2. 62232, we now have 9. That's an increase of 1. And 62239 remains at 11. 62254 remains at 24. 62257 remains at 8. 62258 remains at 14. 62269 remains at 61. And 62285 remains at 7. Also today, it's a happy 40th wedding anniversary to Bill and Linda Whitaker. They're the proud parents of Brian Whitaker, who is kind of behind the scenes some days with this operation. Other days is the guy that asks the questions on Sundays. So happy anniversary. Enjoy your anniversary. I'm sure it's one that you'll never forget, not only because it's 40, but because it's a social distancing kind of anniversary. Hopefully not between you two, but between you and Brian. So I'd also like to say that just to look back, because we always look back on Saturdays, we've had 1,300 people tested since last Saturday. Now we went many weeks early on before 1,300 people in total got tested. So that's a big number. It shows that people are getting out, they're getting tested because it's easy, it doesn't cost anything, and you don't need a reason. So go out and get tested. From those 1,300, we had 115 new positives, so that means that our rate is less than what's required when we reopen in the county. So those metrics are still moving in the right direction. They're where they need to be. So we continue to have hope that we're going to be able to get back to some small businesses opening up, a few other things in the near future. But we did have 11 new deaths, and that is the statistic that we all need to look at and remember when we kind of start to want to slide a little bit. Maybe we're not going to put on a mask. Maybe we're going to forget to do a couple things we shouldn't. I talked to a man from Missouri today. He told me that when they first opened up, there were probably 75% of people wearing masks. He said now he thinks it's down to certainly less than half, if not less than a fourth of people in the stores that he visits of people wearing masks. Let's not do that. Once things open up, the one thing that we have to do is we've got to remember to continue to do all the things that we've been doing until now. We're the reason, you're the reason that the numbers are as low as they are. If you hadn't been staying home, if you hadn't been washing your hands, if you hadn't been social distancing, if you hadn't been encouraging all your friends and relatives to do the same, those numbers would be much higher. And unfortunately, that death rate, as terrible as it is right now, would be a lot higher. So With that, I thank everybody, and let's continue to fight this thing together. Herb?
Well, I think, Chairman, and you said it right, we have to continue doing what we've been preaching and practicing, because even if we don't get the okay to open up before the 29th, when the 29th comes, those numbers are still going to be monitored. And if we fall backwards, then we're going to go backwards, and we don't want that. So, as you said, everybody's been doing their part on and taking care of this. And, to go back on Sam's report, the small child, and you said it best, that child didn't go to the store on their own. They didn't go walking through Walmart on their own. And I think that just reinforces the need for staying at home as much as possible, taking care of those young children, and making sure that when the parents go out, they got a mask on. One thing I want to clear up, there was a comment on yesterday's briefing. They thought that you had said that if you were at home, to wear a mask, and that's not what we went back and listened to it. And you basically said that now if there's somebody in your family that is COVID, then you should, but otherwise just practicing good personal hygiene, hand washing, and at that time you would want to wear a mask if you were sharing the same living space. So I want to clarify that today for the person, and we appreciate all those comments that everybody leaves, good or bad. We've got the ear for you here, as I told somebody yesterday. If we wouldn't be doing these briefings, they wouldn't be getting the numbers that we're giving them, because the local news media, most of them follow our briefings, and you see on the news they put us in there just a total. We're breaking the numbers down to give them a little bit more insight of what's going on here in St. Clair County. So we appreciate you following us. On the EMA side, we announced we'll be getting some more PPEs in this coming Monday morning, hopefully. They've told us that. Tomorrow we'll be doing a question and answer, so if you've got any, you'll be able to post them up tonight, and we'll try to get them answered for you tomorrow when we return around 3:30 for the daily briefing. We'll be back here shortly with Cindy and Daisy to have this translated into our Spanish communities. Thank you once again, and try to have a good evening.